Have you ever imagined a medical treatment so advanced it can literally cleanse your blood, remove the very antibodies that attack your organs, and give a transplanted kidney a second chance at life? This isn't the plot of a science fiction movie. It's real medicine, backed by years of clinical research, and it could be a game changer for transplant survival. Today, we're diving into a new study that has identified blood cleansing therapy, also known as therapeutic apheresis, as a powerful tool to help kidney transplant patients live longer, healthier lives. So, stay tuned, because what you're about to hear could completely change the way we think about transplant medicine. Every year, thousands of people around the world receive kidney transplants. For many, this is their only hope of escaping the exhausting cycle of dialysis and finally regaining some normal quality of life. But here's the harsh truth. The body doesn't always welcome a new kidney. The immune system, designed to protect us, sometimes becomes the greatest enemy by launching what is called antibody-mediated rejection. In simple terms, the body produces antibodies that directly attack the transplanted kidney, leading to damage, organ failure, and sometimes death. In fact, this immune response is one of the leading causes of transplant failure worldwide. But what if we had a way to stop those harmful antibodies in their tracks? That's exactly where therapeutic apheresis steps in. Imagine your blood being drawn out, passed through a specialized filter that removes the damaging antibodies and immune complexes, and then safely returned to your body. It's like giving your bloodstream a reset button, clearing away the very elements that would otherwise sabotage your new organ. And the best part? This isn't an experimental theory. It's already being used, and we finally have long-term data to prove its effectiveness. A 6-year review carried out between 2017 and 2022 analyzed 131 kidney transplant patients who collectively underwent 860 sessions of therapeutic apheresis. The results were nothing short of remarkable. More than 70% of these patients remained dialysis-free after treatment, meaning their new kidneys kept functioning without the need for that grueling, time-consuming dialysis machine. Only 22% of patients eventually returned to dialysis or required another transplant, and less than 9% died during the study period. Even more encouraging, only a single death, just 0.12%, was directly linked to the therapy itself. These numbers make one thing crystal clear. This isn't just a promising treatment, it's a life-saving intervention with solid evidence behind it. Now, you might be wondering, is it safe? Like any medical procedure, therapeutic apheresis does carry some risks, but the data shows they are largely manageable. Out of all the treatment sessions, about 17% resulted in side effects. The most common was a drop in calcium levels, known medically as hypocalcemia, which happened in roughly 7% of cases. Other side effects included mild low blood pressure, temporary heart rhythm changes, vascular blockages, and minor issues with clotting. But here's the important detail. Most of these were corrected quickly and didn't pose long-term problems. Compared to the risk of losing a transplanted kidney altogether, these are relatively small trade-offs. The big picture here is this. Blood cleansing therapy represents a major step forward in transplant medicine. For patients, it means a higher chance of keeping their new kidney functioning and a lower chance of returning to the exhausting routine of dialysis. For doctors, it provides a new strategy in the ongoing battle against antibody-mediated rejection. And for the medical community, it highlights how combining advanced technology with precision care can transform survival rates in a field where every percentage point means more lives saved. But beyond the science, there's a human story. Think of the patients who have been given a second chance at life. People who were once tethered to dialysis machines for hours each week, now able to live more freely because this therapy helped protect their transplanted organ. Think of families who no longer watch their loved ones suffer through constant fatigue, hospital visits, and the fear of rejection. This is not just medicine, it's hope made tangible. Of course, more research is needed. Therapeutic apheresis is not a cure-all, and not every transplant patient will require or benefit from it in the same way. The costs, accessibility, and integration into standard transplant care protocols still present challenges. But the evidence is mounting, and the message is clear. When used appropriately, this therapy can be the difference between success and failure, between hope and despair, between life and death. So the question is, should blood cleansing therapy become a standard part of transplant care worldwide? With results this compelling, it's hard to ignore. It's a medical breakthrough that could redefine transplant survival rates and bring us closer to a future where organ rejection is no longer a looming threat. What do you think? Should therapeutic apheresis be adopted more widely in transplant centers across the globe? Let us know your thoughts in the comments below. We'd love to hear from you. And if you found this breakdown insightful, don't forget to like this video, subscribe to Medical Minds, and hit the notification bell so you never miss our deep dives into the science that shapes our health and future.